Hello, my name is Pedro Fayoni and I'm going to talk about neurological features in severe SARS-CoV-2 infection. For a start, the definition. Coronavirus disease 19, or in this case COVID-19 pandemic, has emerged as one of the major outbreaks to be mentioned in history in coming times. Like severe acute respiratory syndrome, in this case SARS, and Middle East respiratory syndrome, or also named MERS, severe acute respiratory syndrome, coronavirus 2, or SARS-CoV-2, is a respiratory virus infecting the lungs with fever, dry cough, and acute pneumonia, being the major symptoms. It infects the epithelial cells expressing angiotensin converting enzyme 2 receptor, which is crucial for the viral entry. Based on evolving clinical evidence, it is now unfitting to label SARS-CoV-2 as just a respiratory virus, as lately there are various reports that substantiate its pathogenicity in other organs of the body, including brain.
If you start experiencing any new side effects.
If you test positive for COVID and within weeks after you are tested positive, you develop any tingling in your extremities or any weakness or trouble breathing, that's a neurologic issue that needs attention.
The virus can affect patients differently, causing mild to severe symptoms, making it important to talk to your doctor if you think you may have been exposed to COVID-19. For Lee Health, I'm Lindsay Morton.
Applications in medicine. As majority patients show fever, dry cough, breathing difficulties, and fatigue as symptoms, SARS-CoV-2 was primarily characterized as a respiratory virus affecting mainly the lungs' alveolar cells. Speculations of SARS-CoV-2 infections in the central nervous system can be drawn from the past respiratory disease epidemics like SARS-CoV and MERS coronavirus, where various reports demonstrated the presence of virus in brain. The SARS-CoV viral load was found in the brain neurons along with its presence in epithelial cells, lung tissues, thyroid and parathyroid, adrenal cortical cells, monocytes, and lymph nodes in the spleen, etc., as reviewed by autopsy reports. A group of scientists from Taiwan showed that patients with SARS had severe neuromuscular issues like neuropathy, myopathy, substantiating the evidence for its neurological aspect. This further supported the idea that coronavirus can infect and damage the nerve cells.
The reliability of those studies is still in question. Stroke is one of the conditions that has been seemingly at higher incidence in patients who have involvement of the body by the COVID-19. And the mechanism by which stroke occurs in the brain is unclear in this circumstance. It's thought that a lot of it might just be worsening of pre-existing conditions. People who have diabetes, who have hypertension, who have other smoking history, where they have damage to the blood vessels already and are predisposed to stroke already, and now are being stressed from a respiratory perspective by this intense illness, and therefore it precipitates a stroke as a consequence of that. So that may be a more likely mechanism than that there is a specific injury to the brain blood vessels that's causing stroke. The principal things that we'll see from a neurological viewpoint will be changes in mental awareness, cognition, troubles with difficulty of interaction or ability to interact within the environment. I think, again, one of our concerns is how much of this is going to be long-lasting, how much of this is just a temporary effect of metabolic disturbances. So those are very much uncertain points at this time.
Pros and cons. The pros: not all people who became infected die, only a small percentage. Not all people are asymptomatic. Since the physiopathogenesis is known, considerable progress has been made with respect to treatment. And the cons: in this case, more than 1 million people have died. Many people lost their jobs because of that. Some people, after having recovered from the virus, are left with some disabilities. There are still no 100% effective vaccine against this virus.
Taking the waiting period out of COVID testing, rapid testing with 15-minute results. Those are available right now in Nashville. We wanted to check it out so you can know if it's worth your time and money to do it. News 4's Cameron Taylor got those answers.
The timer starts after getting your nasal swab. Dr. Matthew Browning showing us the process for a rapid antigen test. He's the Chief Medical Officer for Urgent Team.
This is a tool that will help to alleviate some of the apprehension and the unknown that you have.
The test isn't for everyone. It's only for those experiencing COVID-19 symptoms in the last 5 days or less. So far, they've tested more than 1,000 people across their mid-state offices just this month.
96.7% of our positive tests are accurate.
The swab gets put in a test tube and sits there for a minute. That gets transferred to the test. After waiting 15 minutes, you put this test cassette inside this machine right here, and it tells you if you're positive for COVID-19. In this case, the results came back negative. Dr. Browning says patients with these results are offered a backup test. It's called a PCR molecular test. It can take a couple of days.
They are advantageous in that they're very quick, but the trade-off is they're not as sensitive.
Dr. David Aronoff is an infectious disease expert at Vanderbilt. He says the rapid test comes with pros and cons.
I think people really have to decide whether the answer that they want is going to maybe be more accurate and take longer time, or they really need to know right now and they're willing to pay that premium to get an answer.
The price? $120 for the examination and evaluation, $50 for the test, all adding up to $170. Dr. Browning says it can be billed to insurance.
So to be able to get...
Now we have issue applied in Ecuador. In Ecuador, unfortunately, it is a third world country that was never prepared for a pandemic of this magnitude. That is why all the consequences that are occurring at this time, there were no medications when the country needed them the most. Hospitals were not ready for this disease, and worse, for these new cases of patients who present with new manifestations, whether neurological, cardiovascular, etc. These patients who present with neurological manifestations must be pending since this virus is just being better understood.
My name is Adrian Owen, and I'm a professor of cognitive neuroscience at Western University in London, Ontario. As more and more people are recovering from the effects of COVID-19, it's becoming apparent that many of them are suffering from short and long-term neurological deficits, and these can include cognitive difficulties, problems with memory, concentration, and even everyday decision-making. These problems could be caused by many aspects of COVID-19, from direct viral effects on the brain to indirect effects caused by inflammation or blood clots, sedation, even being on a ventilator. We're using an online cognitive assessment tool known as Cambridge Brain Sciences that was developed in my lab at Western. And we're going to track up to 50,000 COVID-19 survivors. We're going to test them now and a year from now to try and establish exactly what are the effects of this virus on the brain and on cognitive function. We have more than 15 million people worldwide who have contracted this virus. That means a year from now we may have upwards of 15 million people who have cognitive difficulties that prevent them from doing their jobs or from going about their everyday activities. What we want to do is to get on top of this problem right now, to work out who is affected or who is most likely to be affected in order that we can try to identify strategies that might mitigate the long-term effects of this disease.
Conclusion. Recognition and understanding of the range of neurological disorders associated with COVID-19 may lead to improved clinical outcomes and better treatment algorithms. Further neuropathological studies will be crucial to understanding the pathogenesis of the disease in the central nervous system and neurological and cognitive assessment of individuals after recovery from COVID-19 will be crucial to understand the natural history of COVID-19 in the central nervous system and monitor for any long-term neurologic sequel.
In terms of COVID-19 and stroke in the brain and neurologic science, there are a few neurologic symptoms that are pretty clearly associated with caused by COVID. The most interesting one is loss of smell. Not everyone gets the loss of smell, but if an otherwise normal person who previously had not had any trouble with taste or smell develops that loss of smell, then that's worth looking at possible COVID. Other things can make you lose smell. The question comes up is, does COVID cause stroke? The answer is very rarely, and those are patients that are very sick. Those are the severe patients in a hospital, usually in an intensive care unit. These are mostly patients that have previous illness. High blood pressure is most common, other vascular disease, heart failure. Then they get septic. When you get septic, that means that the infection, whatever infection it is, overwhelms your system. Those patients then can get hypotension, low blood pressure. We think patients that have stroke late in the disease, severe, elderly, those strokes are probably related to the sepsis. So yeah, it's from the COVID-19, but it's because the patient is septic. You come to the ER, and the patient comes to the ER previously healthy with a stroke, chances of that being COVID-19 are very, very remote. Strokes are a late manifestation of severe septic disease with COVID.
Thank you.